Ticagrelor Tablet is used along with low-dose aspirin to help prevent heart attack and stroke in people with a history of heart disease, stroke, or at increased risk for heart disease or stroke, for example, due to diabetes, history of transient ischemic attack TIA. It may also prevent blood clots after certain heart surgeries, such as stent placement. Ticagrelor works by blocking platelets from sticking together and prevents them from forming harmful clots. It is an antiplatelet drug that keeps blood flowing smoothly in your body. The usual daily dosage is 90 mg twice daily, and it is best to take it at the same time each day. Be sure to follow your doctor's instructions for the best time to take this medication. Before taking Ticagrelor, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth as directed by your doctor, usually twice daily, with or without food. The dosage and length of treatment will depend on your medical condition and response to the treatment. Your doctor may also recommend taking a low-dose aspirin once a day. If you have trouble swallowing the tablet, you can crush it and mix it with water before drinking it. Take this medication regularly at the same times each day to get the most benefit from it. Do not increase your dose or take it more often than prescribed. Even if you feel well, do not stop taking this medication without consulting your doctor, as stopping early may increase your risk of a heart attack or stroke. Some common side effects of Ticagrelor tablets include shortness of breath, headache, dizziness, nausea, and nosebleeds. If any of these side effects persist or worsen, it's important to notify your doctor or pharmacist. It's important to remember that your doctor has prescribed this medication because they have determined that the benefits outweigh the risks of potential side effects. Many people who use this medication do not experience serious side effects. Although rare, serious bleeding may occur. Contact your doctor immediately if you experience any serious side effects, such as easy bruising or bleeding, severe nosebleeds, bloody or black stools, vomit with blood, or bloody urine. Also, notify your doctor if you experience interrupted breathing during sleep or very serious side effects like fast, slow, or irregular heartbeat, fainting, confusion, trouble speaking, vision changes, or signs of a blood clotting problem. While it's rare, a very serious allergic reaction to this drug may occur. Seek medical help if you notice any symptoms of a serious allergic reaction, including rash, swelling of the face, tongue, or throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not listed above. If you're in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. If you're in Canada, you can report side effects to Health Canada at 1-866-234-2345. Ticagrelor tablet can cause serious bleeding, so it's important to tell your doctor about any bleeding problems before taking it. If you need to have surgery, make sure to let your doctor or dentist know that you are taking this medication. They will give you specific instructions on when to stop taking it before your surgery. Usually, this medication is taken with low-dose aspirin, which is typically 75 to 100 mg once a day. It's important not to take more than 100 mg of aspirin daily, unless your doctor tells you to do so. Taking too much aspirin can make Ticagrelor less effective. Be sure to ask your doctor or pharmacist for more details. As for the best time to take this medication, always follow your doctor's instructions. If you have any concerns or questions about the timing or dosage, don't hesitate to reach out to your doctor for clarification. Before taking Ticagrelor, it's important to talk to your doctor or pharmacist if you have any allergies or if you are currently taking any other medications. This is because Ticagrelor may contain inactive ingredients that could cause allergic reactions or other problems. Before using this medication, it's important to discuss your medical history with your doctor or pharmacist, especially if you have a history of bleeding problems, gout, liver disease, recent surgery, serious injury/trauma, or heart rhythm problems. It's important to note that Ticagrelor may cause dizziness, and using alcohol or marijuana can increase this effect. It's best to avoid driving, using machinery, or engaging in activities that require alertness until you can do so safely. It's also important to be cautious with sharp objects and to avoid activities such as contact sports to lower the chance of getting cut, bruised, or injured while taking this medication. Before undergoing any surgery or dental procedure, it's important to inform your doctor or dentist about all the medications and products you are using, as they may advise you to temporarily stop taking Ticagrelor before the procedure. If you are pregnant, it's important to discuss the risks and benefits of using this medication with your doctor, and if you are breastfeeding, consult your doctor before using Ticagrelor. Drug interactions can have a big impact on how your medications work and could even increase your risk for serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. There are some products that may interact with Ticagrelor Tablet, such as mifepristone and other drugs that can cause bleeding/bruising, like clopidogrel and NSAIDs. It's also important to be aware of other medications that can affect the removal of Ticagrelor from your body, which may affect how Ticagrelor works. It's also important to check all prescription and non-prescription medicine labels carefully, as many medications contain pain relievers/fever reducers that are similar to Ticagrelor and may increase your risk of side effects if taken together. Lastly, it's important to note that this medication may interfere with certain lab tests, so make sure lab personnel and all your doctors know you use this drug. If someone takes too much Ticagrelor tablet and experiences severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., residents can call their local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of overdose may include severe bleeding, nausea, vomiting, diarrhea, and irregular heartbeat. It's important not to share Ticagrelor tablet with others. Your doctor may also want to monitor your blood count while you're taking this medication, so be sure to keep all your medical and lab appointments. And if you have any questions or concerns, always consult your doctor for more details. If you forget to take a dose, just take the next one at the usual time. Don't take 2 doses at once to make up for the missed one. When it comes to storing Ticagrelor tablet, it's important to follow the specific instructions provided with the product. Make sure to keep it out of reach of children and pets. And when it comes to disposing of the medication, be sure to do so properly by consulting with your pharmacist or local waste disposal company. It's important not to flush it down the toilet or pour it into a drain unless instructed to do so. And make sure to discard the product and it's expired or no longer needed. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.